What's the only injury in the body that has an equestrian reference? You got it, the jockey's fracture, or a fracture of the clavicle. Hi, I'm Dr. Jennifer Tucker, your surgeon in the saddle and host of The Surgeon's Guide to Rider Recovery. And this week we are talking clavicle fractures. If you have suffered one of these injuries, stay tuned to the end of the video where I'll give you my preferred products to make recovery from these painful injuries so much easier. So why is the clavicle fracture called the jockey's fracture? It's because the fracture of the clavicle is the most common fracture sustained in professional horse racing. This injury occurs when we as riders fall and land directly on our shoulder. This injury is also really common in cyclists as they can be pitched out of their saddle as well. And a few other fun facts about one of my favorite bones in the body is that it's the first bone in the human skeleton to ossify, and it serves as the only bone connection between your arm and your body. The shape of the clavicle does affect where your fractures occur. And the clavicle is shaped like a long S, with the medial portion curving out to allow for your neuromuscular structures to pass beneath it, and the distal portion curves back to meet your acromion portion of your scapula. Clavicle fractures are most common between these curves because these areas lack ligamentous attachments to adjacent bones, and the clavicle is the thinnest in this area. When a clavicle fracture is displaced, the medial or proximal side is displaced superiorly due to the sternocleidomastoid muscle, and your clavicle is displaced inferiorly due to the weight of the arm. Shortening can occur, and I commonly see these Z deformities, and this happens because your subscapularis and pectoralis muscles pull and internally rotate and adduct the arm towards the body, thereby shortening your clavicle. So how do you know if you need surgery for your clavicle fracture? Now I'm going to focus on the middle third clavicle fractures for this discussion, but if you have a medial or lateral third clavicle fracture, check out my clavicle fracture video under the ortho info section for a more detailed discussion of these various fractures. Now, we have set clinical practice guidelines to determine which patients would benefit from surgery for their clavicle fracture. These guidelines are created based on decades of research in evidence-based medicine. The indications for surgery are, number 1, open fractures where the bone is sticking through the skin. Number 2, a displaced fracture with a fragment of bone tenting the skin. Number 3, a subclavian vein or artery injury. Number 4 is something called a floating shoulder, which is a clavicle fracture and a scapular fracture. And number 5, displaced fractures with more than 2 centimeters of shortening. Our studies have shown that surgical fixation of fractures with plates and screws result in a higher union or healing rate, and these actually result in better functional outcomes. This is why you need to tell your surgeon that you're an equestrian, and getting back into the saddle quickly is important. Oftentimes, it's not an obvious choice whether to have surgery or not, and your need to get back in the saddle may be the deciding factor. And Khaleesi agrees. Now, remember the beginning of the video when I mentioned my preferred products to help you recover from this fracture? Well, you can use them regardless of whether you have surgery or not, but I've discovered these products because my patients really don't like the traditional slings because of the constant pressure on their neck on the uninjured shoulder. So I have 2 options here. One is a shoulder immobilizer that wraps around your waist. You can get it on Amazon and put it over your clothes. My patients love this because it's easy to put on and take off, and it doesn't bother either of your shoulders. I have other patients that don't mind their sling but could use a little extra padding, and typical slings just have that nylon strap. So check out this sling strap cover from Amazon. I've had patients in South Florida use this even during summer, and it definitely provides additional cushion. And as a bonus, it comes in colors, and when you're done healing, it acts as a seatbelt cover in your car. Now, if you have had surgery, I will warn you that you have nerves that cross over your clavicle that can be injured during your trauma or your surgery. This can result in a numb area or nerves that can be irritated during your recovery. So this makes wearing some clothing, a bra, and an air vest really uncomfortable. So check out these pads, some are silicone and some are nylon, that distribute the pressure over your bra strap and provide additional cushion over your incision while you're recovering. I hope these products help you during your recovery. And if you like this video, please hit the like button and subscribe for more rider recovery content. If there's a topic you'd like for me to cover, please comment or shoot me a message. Your recovery is important to me, and thanks for watching.